Welcome to Duke's Neurosurgery and Specialist Hospital, where we are dedicated to providing top-quality healthcare services that cater to all your medical needs. Our multi-specialist hospital boasts of a team of highly skilled consultants who have been trained both locally and internationally in various divisions of surgery. Established in 2022, Duke's Neurosurgery and Specialist Hospital was founded with a mission to provide exceptional healthcare services that are patient-centered and research-backed.
Truly specialist-led service. This we have decided to do, and we've been doing in the last 365 days with sound commitment to the outcome of patient care. Not like there has not been some shortcomings in our way to achieving this, but the singular word that has kept us going is that we continue to improve on daily basis and introduce dynamics that can only be targeted towards a very fantastic patient care outcome. Okay, and in the field of general surgery, we have an oncologist, a surgical oncologist, and we have also a laparoscopy surgeon that carry out laparoscopy surgeries. Just to go back to the statistics of some of the patients that we have seen, in the last 1 year of existence of this hospital, Duke's Neurosurgery and Specialist Hospital has attended to about 935 patients, both as emergency, during our clinics, or referrals into ward admission for care. The total number of surgeries done so far could be, our statistics showed us that we've done about 96 surgeries in the last 365 days, bulk of which is actually brain and spine surgery, of different dimensions, ranging from brain trauma to brain tumors, vascular malformations, to spine surgeries, both simple spine surgery, pathology and complex spine pathology, including various revision surgeries. The neurosurgery, we've done about 56 cases in the last 1 year, and which includes complex brain pathology, including what we call cerebellopontine angle tumors, skull-based tumors, extensive skull-based tumors, some convexity meningiomas, and huge pediatric brain tumors. And patients have come out with very good and fantastic outcome, as in our patient testimonials all around. Our ear, nose, and throat division at Duke's Neurosurgery Hospital is one of the most vibrant division that we have, and quite a lot of patients have been reviewed in the course of the last 1 year. So have we done a number of complex laryngeal surgeries, been able to record in our kitty successful treatment of a laryngeal carcinoma with total laryngectomy, and the patient is doing fine. Okay, and our orthopedic surgery is manned by 3 consultant orthopedic surgeons with subspecialty interest: general orthopedics and trauma, orthopedics and arthroplasty, and orthopedics and arthroscopy. A lot of knee arthroscopy procedures have been done in the last 365 years with resoundingly good outcome. And hip replacements, knee replacement surgeries have been done with patients having good testimonials about the type of care that they've received. And I will not forget to mention plastic surgery. Urology, yes, we have urologists in our service, and they've done quite a lot of outstanding surgeries, including laser lithotripsy to treat kidney stones, seamlessly done with patient going home within 24 hours of surgery. So, and that's one of those things that had given us good joy in the course of this last 1 year of changing and redefining the dynamics of specialist healthcare service in Nigeria. We want to do more, and we want you to come along with us in this journey. Nigeria healthcare system has come of age, and we truly believe that with like minds joining us in the course of this, we shall actually be able to deliver to the teeming population of Nigerian patients and clients a truly super specialist healthcare service that will attract tourism to Nigerian healthcare. It will be good to note that Duke's Neurosurgery has the support of both locally and internationally trained consultants. And we pride ourselves to have a 4-bedded, fully equipped intensive care unit with on-site anesthetist and 24 hours coverage with anesthetist. This has made us to have good outcome in managing critically ill patients that have been referred to us from far and wide. And we hope that in the course of another 1 year, we will be big enough to serve more patient numbers. We'll be big enough to increase in the type and the modalities of providing super specialist care to Nigerian population. Nigeria deserves the best. The Nigerian patients are worth it. We are improving ourselves daily to be the hub and the destination of health tourism for Nigerians, for Africa, and for the world at large. Thank you. So, just to bring it down such that we can have a complete picture of what is available for you on the table if you decide to approach Duke's Neurosurgery and Specialist Hospital. We have a very functional outpatient clinic that is being run only by consultants. By this, we refer to clinic days for neurosurgeons, for ear, nose, and throat surgeons, for general surgeons and surgical oncologists, for orthopedics and trauma, arthroplasty and arthroscopy surgeons. We have clinic days for the plastic and reconstructive surgeons, and also for the urologist. We are also experts in stroke management because we have a full complement of the neuroscientists that are needed in this. By this, I mean the neurologist, the neurosurgeons, and the neurorehabilitation unit that is fully functional. The neurorehabilitation unit is also run alongside with our fantastic and super qualified physiotherapist that has been providing excellent recovery plan for our patients. And about the facilities that are available besides the outpatient clinic, we have a fully equipped, functional 2 operating theaters with complements of endoscopy gantries for endoscopy procedures. We do endoscopy procedures for brain surgery, for spine surgeries, orthopedics, and we also do, of course, laparoscopy surgeries for the general surgeons. All these are available. We have intraoperative X-ray that makes our spine procedures, spine surgeries, be it simple spine surgeries or complex spine surgeries, much more easier to go by. Okay, and there are, like I said earlier, there are 4-bedded, fully equipped ICU with ventilators and monitors, defibrillators. We have high-sat machines to monitor the blood, the ions, the blood gas. We have a fully equipped 2-bedded accident and emergency unit, and there is 24-hour laboratory service, and the turnaround time is excellent because we know that laboratory results are essential components of making good decisions on patient care. Of course, there is 24 hours power supply, and you can be so sure that your patient is going to be conducive in the environment that Duke's Neurosurgery and Specialist Hospital has created and is also improving on a daily basis. Patient care is holistic. So from entrance to discharge, you have free interactions with our super qualified medical professionals that attend to your needs promptly. Our nurses, well trained, qualified, and they are empathetic with patient care. They are professionals that have been in the field of practice for a while, and they have been doing well, and they have been doing well in caring for our patients. We hope that you will pay us a visit and take a look at the table of super specialist care that Duke's Neurosurgery and Specialist Hospital has gotten ready for you. I am sure that a trial will convince you, and we maintain our vision, and our mission is to produce and deliver patient-centered care that is research-based and world-class. Duke's, in the next 5 years, has identified a lot of gap in training and in delivery of care in Nigeria. One of the major visions of Duke's in the next 5 years is to have a wet lab, where we call the skill laboratory, where we can encourage training of the upcoming doctors that have interest in specialist care, to help to refine the skills and also to develop new procedures. It is high time we stopped depending on the Western world for all the new development in healthcare delivery. We know that by Duke's intention and plan to open a world-class skills lab for training and retraining of consultants and residents and young doctors, the acquisition of skill set and ability of Africans to deliver quality healthcare to the African population is going to greatly improve. The other component of our vision in the next 5 years is to introduce to the landscape of this country purpose-built specialist healthcare centers across the length and breadth, fully equipped to deliver only specialist care at its best. And we hope you come along with us in this journey as we continue to push to redefine the narratives of specialist healthcare delivery in Nigeria. Thank you. The journey of 1,000 miles starts with a step. That can only describe the phases that Duke's Neurosurgery has been through in the last 365 days. When we started, the only thing we had was the vision and the zeal to do it right, which is still very much there up to now. So we started in a small place. When one of our senior colleagues decided to close down his practice and put it to us. And we started putting things together, ensuring that in the course of this we maintain the standard. People came to us because they trust us. They trust our service. They trust our sincerity to always give the best. So with the support of people, patients coming to us, Duke's Neurosurgery has been able to grow tremendously in the last 1 year to what is variously described today as an emerging force in specialist healthcare in Lagos and Nigeria. We started with a one-bedded ICU facility with one single operating theater with optimal instruments and just a recovery room. Now, the Duke's Neurosurgery and Specialist Hospital joyfully informs you that we've improved, we've expanded. We now have a standard emergency unit that can take care and handle all forms of surgical and medical emergencies. We've improved. We now have a fully equipped laboratory facility that can practically deliver all laboratory tests at the shortest turnaround time possible. We've improved. We've been able to increase the one-bedded ICU to a fully functional, fully equipped, four-bedded ICU that has been rescuing patients and has been giving them good outcome in the last few months. We've improved. Now we have two functional and fully equipped operating theaters, meaning that surgeons can operate hand in hand and we could do as many as possible surgeries within a 24-hour period. We have improved. We will continue to, because the goal is clear. We are redefining the specialist healthcare service delivery in Nigeria, in Africa, and in the world at large. Come with us. Let's walk this way together. In the world parlance, solving problems bring good news, and words could tag along. Africans for Africans is actually born out of our concern on how Nigerian patients, African patients scamper around the world, paying out of pockets, paying huge money for specialist health care that can be gotten within the shores of their own country. Worse still, some of these our patients are treated as second-class citizens in the developed and third first world that they go to receive healthcare service. Most of them return back to us, and we actually need to revisit some of their surgeries. And in terms of follow-up, after initial intervention in the developed world, close to zero. So this is one of those things that had encouraged us and had put into our heart, impressing it on us firmly, that we really need to develop a truly specialist healthcare that can solve this problem, bridge this gap in such a way that Africans now will start treating Africans. But we are not going to be treating Africans in a substandard way. We'll treat them giving them the excellent healthcare equivalent at par to what is available in the developed world. And this is one of the reasons why Duke's Neurosurgery is proud to announce to you that we are on daily basis acquiring modern, newly functional instruments to help us to match up to standard of what the healthcare delivery is like in the developed world. Are we building partnership with the developed world? Absolutely yes. Do we have relationship together? Absolutely yes. But the goal is still maintained. The goal and the vision is clear. Africans should treat Africa. Not only to do surgeries for them, also to follow them up and to deliver the healthcare service that we all desire. Nigerians should believe in Nigerian healthcare system. We have one of the best brains anywhere in the world. some of us have decided to use this to treat our Nigerian patients. Despite all our local and international qualification, it is time for Nigerians to start believing in Nigeria healthcare system, because this is the only way forward. Thank you.